course, one of the things that the President stressed last night is that if we increase our vaccination levels across the country, then we could enjoy more and more freedoms. And of course, that's been a massive program that has been rolled out. Now, today, problems with the storage of COVID-19 vaccines and the disposal of used vials was raised as a number of concerns by the Auditor General. The Finance Watchdog says while overall the Health Department cannot be faulted for its vaccine program, there have been some shortcomings. The Auditor General's office briefed Parliament's Health Committee today on that audit. Lindsay Dentlinger reports.
The audit of the COVID-19 vaccine program was conducted between May and August last year at the behest of former Health Minister Zweli Mkhize. The Auditor General has consequently flagged concerns related to the selection of vaccine suppliers.
It may render the process unfair because the person did a tender, they won the bid outright, they scored the highest points, so you should have awarded. Then you say, I'm mitigating a different risk, and you then act differently in terms of assigning it to an additional service provider, but the reasons were not always clear.
Following visits to 45 vaccine sites, it also observed protocols for storing vaccines, and the disposing of used vials weren't always followed.
It's for the department to go and really determine who was assigned the responsibility to adequately deface or destroy these vials. And if that person didn't do their job, what is the follow-up procedures in terms of consequence management? And I know I'm oversimplifying it, but really, Chairperson, it is that simple in terms of the policy and guidelines.
Connectivity issues and the lack of information technology have also impacted the use of the electronic vaccination data system.
There were issues around the changes in the systems that were logged manual or not logged on EVDS, which then raises the challenges that if we don't know what changes were made on the system, you're not able to see if changes were authorized. There were challenges around the back capture, which then impacted the overall reporting by the department. Some manual forms that were being used because of the connectivity issues were not completed accurately, which then impacted the information that was then being inputted into the EVDS system as well.
The Auditor General's office says it's now up to the department to explain how it will minimize wastage in the system as the vaccine uptake declines. Lindsay Dentlinger, Cape Town.